it's considered to be a diagnosis of, or the common understanding is that it is mostly a childhood disorder, but the numbers that I just reported kind of negate that finding and or understanding or common perception. And it appears that it's very prevalent in adults too. What is your understanding of that?
No, I think that's a very genuine question, and I really appreciate you and your channel for increasing awareness about the mental health in general and about ADHD. I think what I have been seeing both in my clinic practice and also in my teaching, that ADHD, what the common people think about hyperactivity, impulsivity, someone is having difficulty sitting still, someone is fighting, having a lot of anger outbursts. So ADHD has three presentations. One is called inattentive type, second is hyperactive, and third is combined. So children who struggle with the hyperactivity, impulsivity, they are very easily recognized because the teachers complain about it, parents are embarrassed what they are doing. But many times what we are seeing as an adult ADHD, which is diagnosed in being adult, is actually started very early in their childhood, mostly the inattentive presentation, where they may have been struggling with paying attention, distracted, losing things, misplacing things, room is messy, but they may have high IQ. They may have a very, you can say, parents are very educated that they have seen this child doing really well academically, but makes careless mistake, doesn't make room clean, or doesn't, forget do things. So they may have been doing a lot of things for the child. And the academically, and the other myth about ADHD, if someone has ADHD, why they are doing well in school. Both are very different things. It may contribute to the school performance, but kids with ADHD, can excel in so many things as well, because it's not a problem paying attention, it's a regulation of attention. Like I can share a couple of examples. When I was doing my training at Harvard Boston Children's Hospital, we have a Boston Latin school next to it. It's a very competitive school. Especially in girls, the inattentive is more common. So we have now the teenage girls, parents say she has been A+ throughout. No complaint from school, most obedient, most, recognized in the school. But now she started in this competitive school away from home. And now they are seeing that she's struggling with keeping things on time, reminding, all those things. And let's talk about, I have a mom who, when she got a second child, then she came to me. She was thinking I have ADHD. And when I explore, she has been struggling with an inattentive type, but, very loving, caring parents, a lot of high IQ. But now when this, as a parent, so much chaos come. And now she has been having difficulty, making things on time, forgetting things. But once you circle back, it's a neurodevelopmental disorder. There are subtle symptoms throughout childhood, but due to many factors, it may not have been recognized. So what we are seeing, as an adult ADHD, most of the time, it could be masked because of their strength, because of the family. And now it is becoming more obvious when they are getting a job, that is very high demanding, when they are living outside the family, when they are having kids, or when they are transitioning into the phase that they are struggling to.
Very interesting, how you say that there are a lot of, the common perception or the common understanding is that the kids who have ADHD mostly have focusing problems, and they're unable to perform at school, and that's when it becomes manifest, or it becomes apparent to teachers, to people, and that's when a lot of people end up seeking help. The other aspect of that is too that they just kind of label the child belligerent or rebellious, and they just refuse to accept that there be more to it, and his outbursts or his inattention or his lack of focus is not just because the child is refusing to do that, but also it's stemming from his inability to focus on things because of this disorder. So I'm sure you run across such patients a lot too.
Yes, I think that's a very good, the way you put it. It's very interesting, and I kept smiling because so many examples are kept coming in my mind. So remember I mentioned about ADHD is not a problem paying attention, is a regulation of attention. So what the regulation mean? The child can focus 110%, or even if you allow me to exaggerate, 1,000% focus in things that they are interested in, and that is the reason, you can see why it's so frustrating for parents. They are seeing when the child is playing video game, 1,000% focused. Even one of my mentors say, even a bomb go outside, their focus is so much, they don't know. It's a food time, they don't care. Mom is they so they can even hyper focus on things that they're interested in, arts, craft, but they may struggle things that are boring, that require more effort, that are tedious, that require small detail. And that's why they may struggle doing homework, but they are excellent in so many things. And parents may think, and that's where the label come, they are lazy, they are what I call they are not appreciative, they are spoiled, they are manipulative, because whenever they want to pay attention, they can, but when they don't want to, they don't, which is I really feel for these children. So I always this analogy to the parents, and that many times helps parents to understand. I tell them, let's say if someone has a stroke, and because of that stroke, their right side leg is weak. Okay, so this person cannot move the leg. Okay, so let me just repeat. There is a difference between a can't and a won't.
Yeah.
This person cannot move the leg. You give that person, I will give you $1,000. Please move your leg. I will buy you, the Mercedes, or let's say Tesla now. Maybe the Mercedes is too low now. So I can buy you this. I can do that. And when that person cannot move the leg, you will label it. You're so lazy. You're so spoiled. My father never offered me Tesla. Again, there was no Tesla at that time. Anyway, so my father never did this thing. I am trying so much to help you. And you are so unappreciated. You can see, how it's going, because that person cannot move the leg, and it's causing more shame, it's causing more guilt, it's causing more frustration in that person, because this is a can't territory. And let me tell you another thing, that person want to move the leg, but cannot move the leg. Similarly, kids who struggle with ADHD, some areas are can't territory, things that are boring, that are multi-step commands, that are, lot of things, that requires a lot of efforts. Even if they want to focus, they cannot focus it.
So so you feel for the kids, but then again, a lot of times it's just under recognized, or parents sometimes, when their kids are excelling, or when they have other kids who do not have any similar problems, they just refuse to see the obvious too. I've seen that, in a lot of, like you said, educated and well-to-do families, smart parents, but they're just decide to ignore the signs. So that's something that we've seen very commonly too. But in parents' defense, this is not something that's very obvious, and our first reflex, knee-jerk, is to say that the kid is not interested, or the kid just doesn't want to put in the effort, because like you said, that he has nothing, he's not wanting for anything, especially in our circles. But also to add a little bit of ambiguity to the whole picture is that ADHD is not something that that you could recognize or treat or diagnose by just doing, like, running a blood test or doing some sort of imaging. It's a clinical diagnosis, and that makes it so much harder for people to recognize, to diagnose, and then eventually treat it.
I agree. And one thing I also want to highlight, I strongly believe is not the ignorance from the parents. Even in my practice, I have seen even psychiatrists, even child psychiatrists, even seasoned psychiatrists have been missing this. Because most of the time, especially in teenagers or even young adults, they come with depression. Let me give you another example. I was seeing this consult. A child came after, he jumped from I believe, third floor window and broke, a couple of legs. So they called us, a psychiatry team, that this is a severe depression. Please come and start some medication-free depression. So I came, and one thing what I learned with my training is it's important what is happening, but it's also very important why it is happening. What is the story behind it? What is the functioning behind this behavior? But and the other analogy that I give to the students and to the practitioner is that iceberg analogy. So the tip is what is obvious. And unfortunately, when parents bring children to us, they only bring in the tip. And the tip for this child was he jumped from the window and broke legs. And so when I was exploring, so mom, I was getting all the information. Mom was saying, she wanted to get the phone away. And he said, I'm not going to give you. And she said, if you're not going to give me, I will take away all these things. And he said, okay, you don't love me. You don't care me. I don't want to live. I want to jump. Something that he did happen, and he actually jumped out of the window. So you can see the suicidal ideation and attempt is not a diagnostic criteria of ADHD. You can see why people may think this is a depression. But now when I am understanding the story, mom is telling, from very early age, struggling with paying attention, focus, forgetfulness, low grades, frustration tolerance, sitting still. And on that day, he has a lot of impulsivity. And on that day, just out of, he has not been feeling depressed, he was just got angry, and out of anger, he did this. There was no depression there, but it was actually ADHD. So you can see why even a seasoned practitioner struggle to diagnose it. So I cannot even imagine how parents can identify this, because it's not easy, as you mentioned, because we don't have blood tests, we don't have,
imaging
and imaging, diagnostic imaging. But what I would say to parents, that your child the best, and you have all the skills. If God has given you children, he also give you all the strength, all the potential to raise them. And so you are trying to raise, you are trying to do your best, but because of all those efforts, if the child is struggling, so don't see it as a failure on you or on a child. If despite all those efforts, if you see the child is still struggling, get some professional help.
Yeah. So basically, the gist of the conversation is that if you see something abnormal, don't just think that it's either you or the child, or the child is just being difficult or hard. If it persists, and especially if it persists not in all aspects of his life, then you should probably ask or have some professional help. Yeah, that's a very important point that you made, because we as parents don't or understand or recognize the signs, and not and a lot of times miss the point where help should be sought, and that makes our lives, and particularly the children's life, very difficult. Also, the other thing that I kind of alluded to it in the beginning too, was, are we seeing an increase in the incidence of ADHD? And if so, why? Or is it just that we have become more cognizant of the disorder, that we're recognizing it more and more, and it has always existed, but we just weren't aware of it and weren't really looking for it?
I think definitely having more awareness, having more, now you can see even a lot of pediatrician, they have, I don't know if they have the child psychiatry rotation yet, but they have a significant curriculum on mental health in their didactics, in their course. And then there is a lot of social media awareness to it. And so I think, and then the child psychiatry programs, and there are a lot of collaborative efforts between mental health and the pediatrician and general practitioner. So I would say the increase, so-called what we are saying, is because we have more awareness to it.
Okay.
We have, just like you can say, just like, in India, Pakistan, we didn't have angiography there, but people were still struggling with heart attack, but they were dying. But now, and since the angiography came, echocardiography came, we are recognizing more and more, and we know people are coming even earlier because there is more awareness. Similarly with CT scan, you can go with the chest, now. So there are so many reasons what we are seeing increase is most likely because we did not have that sophisticated training, awareness, and now people are more being recognized, especially school. There are a lot of training in school that is happening, how they be more aware of it. And many times in my practice, we get consults from school, and that's the child struggle, because that's where the most boredom and all those activities happen. So I think these are a couple of reasons that we are seeing more and more.